Hello, and welcome to Erlanger's Joint Replacement Program. I'm Trina, one of the orthopedic nurse navigators at the downtown campus, and I will be talking to you today about what you can expect from pre-testing through going home at the end of your hospital stay after total joint replacement. We have a whole host of nurses and care providers on our team looking after you during this journey. You have your surgeon and their office staff, anesthesia, nurse navigators, and inpatient nurse practitioners who will look after your internal medicine needs during your hospital stay, as well as the nurses, patient care techs, physical therapists, and case managers. Your first step in the process after your surgery is scheduled is going to be pre-testing, which usually takes place about 1 to 2 weeks before your surgery. When you come in, we will ask a lot of questions about your past medical history. We will collect an accurate list of all medications you take on a regular or daily basis. In addition to blood work, we will use a nasal swab to test for staph in your nose. A small percentage of people have staph colonies present in their nose, and this can increase the risk for infection after surgery, particularly in hip and knee replacement patients. All patients undergoing joint replacement surgery will be prescribed an antibiotic ointment called Bactroban or mupirocin. This will be used in your nasal passages twice a day for 5 days prior to surgery, reducing your risk for infection after total joint replacement surgery. You will receive instructions for skin prep to ensure your skin is free from bacteria before surgery. This involves using a special antimicrobial soap called chlorhexidine gluconate, CHG, or Hibiclens, which we're going to provide to you before surgery. You will wash with this soap 2 times before your surgery, the evening before, and again the morning of surgery. After asking all of these questions, we won't see most of our patients until the day of surgery. So if you have any changes in your medical status, please reach out to one of the nurse navigators or your surgeon's office to let them know.